Hello friends, Nerd Pediatrician here. Today we're going to talk about the stomach bug, vomiting and diarrhea. Disclaimer first, this information is being presented for educational purposes. It is not intended to diagnose or treat your sick child. One other first things first, sometimes kids puke. So if it's a one and a done thing and your child is otherwise acting like their normal self, don't sweat it, move on with your life. What we're going to talk about today is acute gastroenteritis, which is almost always caused by a virus. This is a very common thing in kids. Typically, we see more cases of it in the winter and fall. Viral causes are by far the most common reason for this. They typically start very quickly with the vomiting and usually are followed by diarrhea, sometimes fever. Now, prolonged vomiting or diarrhea over several days, especially if the child is very ill appearing, can be a suggestion for bacterial cause. Vomit is almost always going to be a light yellow tinged color, and that's because there's always going to be probably a little bit of bile that's reflux into the stomach. Vomit that is bright yellow or green we call bilious emesis, and it could be a clue to intestinal obstruction. Now, the other colors we like to watch out for are anything that might indicate blood. So blood in the vomit can be bright red or black, what we call coffee ground emesis. Blood in the stools can also be bright red or black and sticky and tarry, and we call that melena. The difference in colors has to do with where in the gastrointestinal tract the bleeding is occurring. This is very uncommon in a routine stomach bug, but something certainly to keep an eye out for and that you would want to discuss with your pediatrician. Nearly all of these cases are caused by virus, so an antibiotic is not going to be helpful here. Like many things in pediatrics, we rely on symptomatic or supportive care. The biggest concern here is that if your child is not eating or drinking and is puking everything up, that they're going to begin to get dehydrated. So first we're going to talk about some signs of dehydration in young kids, and then also what you can do to help them prevent dehydration. For parents, what I want you to focus on is their urine output. So how often they're peeing, and then also what color their urine is. So healthy urine in a hydrated person should be clear. The darker, more yellow urine means that the urine is concentrated and that the body is really trying to hold on to those fluids, which would suggest dehydration. So a rough guide for when you should be concerned about dehydration in your child. So for kids that are very young, say 0 to 4 months, we expect them to have 5 to 6 wet diapers a day. So if you see that dropping off, that's a concern. And then for older kids, older than 4 months, they should be peeing at least 3 times a day, so about every 8 hours. So as pediatricians, when we see these kids, very common for us to say on autopilot, hey, push fluids. But really, what does that mean, right? Give me some details, give me some objectives. So that's what we're going to talk about next. The best thing to prevent dehydration or to get your child rehydrated is to use something called an oral rehydration solution, ORS. So Pedialyte is going to be your go-to here. Now, a lot of times I will tell parents, look, if your child won't drink the Pedialyte, but they'll drink Gatorade, that's almost just as good, which is true. However, Gatorade and sports drinks tend to have a higher sugar content, which can upset their stomach a little bit and sometimes cause a little bit more diarrhea. In infants, so babies less than 12 months of age, the only things we want you to give them by mouth are going to be an ORS like Pedialyte, breast milk, or properly mixed formula. We don't give water to young babies. We don't give them fruit juice, broths, anything like that can make the situation worse. There's absolutely no reason to stop breastfeeding a breastfed infant if they're having vomiting or diarrhea. And then for kids older than about a year, you're going to want to start with that oral rehydrating solution like Pedialyte. They can also have water. If all they want to drink is milk, that's fine. Now, sometimes these infections will cause a temporary lactose intolerance. That's because of some enzymes in the intestine that more or less get washed away, but it tends to be mild and very self-limited. If they tolerate the ORS and the water or whatever, well, you can move on to some clear juices like apple juice or cranberry juice. Talked about what fluids to give your child. Next, we're going to talk about how to give them, how often, and how much. So the key is to start slowly. For infants, kids less than 12 months of age, I like to give about 5 to 10 milliliters of Pedialyte. You can give that on a spoon or through a syringe. You can do that about every 10 minutes and just see how they tolerate it. For kids older than about a year, you want to target ½ ounce to an ounce of Pedialyte every 15 to 20 minutes. And again, advance that amount as they tolerate it. Quick note that if your child pukes in the middle of this, remember that most of the liquid that they have taken down already is still in their stomach. So no big deal. Give them a break and then push on in a little bit. Pedialyte, they can also have water. If all they want to drink is milk, that's fine. Now, sometimes these infections will cause a temporary lactose intolerance. That's because of some enzymes in the intestine that more or less get washed away, but it tends to be mild and very self-limited. If they tolerate the ORS and the water or whatever, well, you can move on to some clear juices like apple juice or cranberry juice. All right, so the next thing we want to talk about is resuming a diet. If your child is feeling better and is tolerating liquids, there's absolutely no reason to progress to an age-appropriate diet. The important thing here is to start slowly. So a few bites, let it sit, see how they're doing, and then take a few more bites. Now, we used to always promote the so-called brat diet, so bananas, rice, applesauce, and toast. And there's really, not any good reason to follow that. It's unnecessarily restrictive and it doesn't provide good nutrition. So we say, look, advance them to their regular age-appropriate diet with the caveat that you really want to avoid foods that are high in fat content and have high simple sugars. All right, next let's talk about medications. Most of these children are not super sick. And if they're not dehydrated or only mildly dehydrated, they don't need any medications at all. For kids that do have some degree of mild or moderate dehydration, your pediatrician may suggest a antiemetic or anti-puking drug. Typically, it's going to be something called ondansetron. The recommendation for kids in this situation is to give one dose and not to repeat the dose after that one dose. So the idea is to kind of break that vomiting cycle, give their belly a break, and then allow you to start advancing their liquid so that they can get on top of any dehydration that has or will develop. For diarrhea, pediatricians always say feed through the diarrhea, and there's a couple reasons for that. Number one, the most common medications that older people use for diarrhea are what we call anti-motility drugs, so loperamide, are also known as Imodium. And these drugs, by design, decrease the motility in the intestines. So the thinking is that it just sort of prolongs the misery. Also, we can set you up for complications, so something called a paralytic ileus or something called toxic megacolon, which is as scary as it sounds. And then finally, these medications carry the risk of central nervous system depression, so we don't use them. And then the other class of medication for diarrhea is what's called anti-secretory drugs. So think Pepto-Bismol. We don't like to use those at all in children because of the risk of salicylate absorption. And this is the same reason that we don't give aspirin to kids less than 18 years of age. So feed through the diarrhea. All right, and then a quick couple words on pre and probiotics. So there has been some research into this, and the evidence is really just mixed. There's really never been anything that has shown a clear benefit to giving prebiotic or probiotics to kids in this setting as far as shortening the time course of their symptoms. Another thing to keep in mind is that these are not regulated by the FDA, so we're always concerned about unlabeled ingredients or contamination with bacteria or fungus or other pathogens. So jury is still out on that. Finally, things to watch out for. Again, the intent of this conversation is to talk about kids that are otherwise generally healthy, not super ill appearing. If your child has prolonged vomiting, so in a young infant, 1 to 2 months of age, anything greater than about 12 hours, Kids less than 2 years, we're talking greater than about 24 hours, and then kids older than 2 hours, anything longer than 48 hours, might suggest something that's going to need an intervention. So you would definitely want to seek medical attention right away. Some other red flags to watch out for: so severe abdominal pain or unrelenting abdominal pain. A lot of times kids will complain of belly pain, but once they throw up or pass a stool, they feel better. So if that pain is always present and getting worse, absolutely want to seek medical attention. And then for like all other illnesses, you want to watch out for a change in their level of alertness, if they're becoming lethargic, or if your child is complaining of a severe headache or a stiff neck. Basically anything outside of the picture of a kid with a stomach bug should not be ignored and should be brought to the attention of a medical professional. So there's a lot more to know about this. Many things can cause vomiting and or diarrhea. The intent of this was to give you some information on the most common cause in a child, which again is going to be viral acute gastroenteritis or the stomach bug. If you have any questions or concerns about your child, please don't hesitate to reach out to your pediatrician or take them to medical attention, whichever way that you best see fit. I hope this information was helpful and gives you some confidence. And if you have any questions, please drop them in the comments. And more videos coming sooner. So if you have any suggestions for topics, drop them in the comments and I would love to see them. Thank you. Nerd Pediatrician out.